If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. In this episode, I speak with Norman Shamas, privacy lead at Google. Our conversation is more of a rant on what privacy and security can ultimately mean for marginalized groups and the downsides of our current privacy systems, and what, if any, implications are there when patient data is handled by many parties in exchange between multiple sources. I learned a lot, and I hope you will too. Let's get started.
So you are a privacy lead at Google. You also have, from my own research, a very long and impressive career in sort of data information exchange, privacy, and consent for marginalized groups. I am extremely curious about your career and your work in privacy and what got you started. Can you tell me a little bit?
Yeah, and it's sort of it's sort of funny ending up, we'll say, at Google, and really it's more Fuchsia operating system. So it's a new open source operating system, which is like really exciting with sort of its goals. It's built from the ground up, and we're trying to incorporate privacy sort of from the very beginning. And I got started in privacy just from growing up as someone who is from a marginalized community in the U.S. and having to, we'll say, experience the notions of sort of like surveillance. Some of it's linked to policing, some of it's linked to like border crossing, seeing all of this in practice. And but I guess we'll say like I more formally started working in privacy and technology probably in graduate school. I was starting to get into it, and then after graduate school, when I moved to DC and started working the human rights and digital rights and international development space, I have a very complicated relationship with that space, especially with questions around sort of like health, who controls the data, the data stewardship of all of this data for folks that maybe don't have a voice or are represented in the world, or sorry, in the room. Also, probably on that larger world scale as well, and had sort of like has shifted from we'll say more information system design to really deeper dive into sort of security, into like mobile security in particular, and slowly realizing that what I was really thinking about wasn't necessarily just information security as a field that's been defined, but really privacy. And in particular, I find privacy to be a lot more focused on agency, on consent, and on, we'll say, the human element, which fits with me a lot more than some of the security methods can.
But just to go back a little bit on consent. So this is something that's very big in healthcare. A little information for you. My background, I have done clinical research before. Very much a fan of informed consent. Love to see digital health companies currently right now trying to iterate on what consent looks like, letting the users of their companies know either through their FAQs or some sort of on-site content resource area, you know, who they are as a company, what they're doing as a company, if and what kind of data they're taking, usually sort of seen in the privacy and regulations that they post out. But there is this larger conversation around consent. And when it comes to data, especially patient data that ideally would flow between multiple systems, it does get a little muddied. And so talk me through like what you think if a company was trying to make sure they had good consenting practices, right, for their users. What should they be thinking about when knowing that the data that they're going to intake is going to go to multiple sources?
Yeah, and this is an extremely complicated space in some ways, especially when you are talking about like health information systems in the U.S. where you maybe have insurance or other requirements that come in. And there's a very strong power dynamic here, because oftentimes if you don't sign like a HIPAA consent or a consent form, then you're seen as not being able to receive healthcare. And so there's the element of, let's say, like legal consent that's sort of within this, and I think that's where a lot of folks and companies have focused on, because that provides that legal coverage and that compliance element. But there's a whole element linked to information that maybe isn't necessary for everyone to have access to, but maybe you need for a specific reason. And one of the clearest examples to me is the insurance information. And we have an arcane system in the U.S. where apparently we still use gender as an indicator for insurance purposes. And so if someone doesn't identify, for example, with their gender that their insurance company sees or uses, there's definitely going to be questions from the healthcare company side around like who should access that, in terms of like who should access both like someone's preferred gender and identification, as well as like the information that's needed for billing, and making sure to have thought through all the implications of that. And so thinking through some of those power dynamics, thinking through some of that information that's not necessarily needing to be used for all purposes, and who generally has access to them. I don't think a lot of healthcare companies are necessarily thinking through all of this, at least at that level of details. And oftentimes there isn't a way for them in their internal systems, maybe like as easily, to separate out, let's say, like a preferred gender from like a billing gender that comes in on an intake form. And that might be stored together. And so there's like technical elements in terms of how you can control those information flows, as well as for these human process elements that I think are, we'll say, like missing maybe at that sort of health information perspective. And unfortunately, there's things that have to be shared, again, with the insurance company. And making sure folks understand at a minimum like why this information is collected is at least like a step forward to try to help explain and not cause additional issues. Again, the gender is like such an easy example because it can cause problems with insurance. It can cause problems with whether someone's able to afford healthcare or not.
Yeah, that is a potent example of it, and I would agree with you that there's probably multiple layers around privacy and consent, and maybe healthcare has only hit a certain level of it, especially as people are now using more and more devices or services, products or services to manage their health. It's just a conversation that probably needs to be revisited, and some infrastructure and architecture around that I think is definitely needed, because from my side of the world, what I see often happening a lot too is, just the data in and of itself is a lot, and trying to clean it, scrub it, sanitize it, build it up to make it a nice story is also very hard. And so I could also imagine a world in which, sometimes these things are shared in accident, not necessarily on purpose, but just on how it's collected and how it's then shared. That's really important. So the other thing that I'm noticing on my side is that right now there's a large conversation going on around data privacy in healthcare for a variety of reasons. We can talk about the decision with, Roe v. Wade. We can talk about just the proliferation of people using wearables and apps, issues with certain companies sharing data out with employers, health plans. How's that information going to be shared? The thing that I'm also seeing a lot is that there are a lot of governing bodies when it comes to data privacy. And so I can't make heads or tails of who's in charge or which ones should be followed necessarily or all the time around data privacy and cybersecurity. So I'm curious from your career and your understanding of that side of the world, how do you think the regulatory bodies are thinking about privacy in 2022 and then 2020 or 2050, for example?
Yeah, I think the way that people are thinking in healthcare in particular about privacy and regulations, really HIPAA, which is a little bit arcane and definitely not up to date. And talking about wearables, when you think about even sort of like wearables and consent or health information or data that can be linked to health information, you get into these really interesting ways that people will get around regulations. Most wearables are not governed by HIPAA and HIPAA compliance, and that's because they're sort of called these sort of fitness apps, and so they're able to get around certain regulations because they're not classified as health data or patient data, and that's a limitation really within sort of HIPAA and how some of this is defined and what that regulation covers. On top of that, within hospitals themselves, and this ends up being, we'll say, more of a security issue, but it has massive implications on privacy as well. There are regulatory bodies around equipment and equipment certification. And this can lead to instances where hospitals have vulnerable devices or machines that are hooked up to the internet and the computer. And this has been seen with things like the proliferation of WannaCry ransomware and how that affected hospitals in particular. And even if the hospitals have the capacity in terms of like having a security expert, they might not even be able to actually update these devices. And so they have to figure out other ways of, let's say, designing their network or protecting these, again, extremely sensitive devices that can leak all of this information. And so that regulatory environment is extremely complicated, and I don't think there's an easy way of balancing this question of what should be connected up to like networks, computers, having them sort of like integrated to such a degree in their accessibility in terms of like certification and like high tolerance or low tolerance, I should say, for like faults because it can kill someone or have like very negative effects on someone's health. In terms of integrating that with the need for how we think about technology these days. And again, I think of wearables as very similar. There have been issues in some of the early days with not necessarily wearables, but we'll say like IoT devices that could be linked to health. The one that I immediately think of are some of the internet-connected dildos, so the teledildonics space, that were sort of collecting sort of information linked to, I don't remember if it was linked to use. There was a big lawsuit against, I think it was WeVibe, that was sort of resolved, and they've actually become like really great around sort of privacy in terms of that data collection. But the devices themselves send information between the device and the app that can also be indicative of use and are not necessarily super well protected. And some of this comes into like Bluetooth as a protocol. And so I think there's also folks that are trying to like figure out how do we help improve this whole like IoT ecosystem to ensure that the devices that have, computers in them and could be vulnerable, whether it's a refrigerator, whether it's something, linked to health or a wearable, have certain standards that they're getting updates and are protected. And so there's like a whole other realm that's not necessarily directly linked to health data. And then, not even talking necessarily about like the Roe versus Wade, sort of sideline of sort of information, but I think that's an area that, regulators aren't necessarily thinking about, or at least in the U.S., the way that regulators are thinking about it and responding is, we'll say, trying to balance this idea between law enforcement needs and sort of privacy, and with sort of prioritizing that law enforcement need. So it's unclear what it would take or whether it would be possible to have a large-scale privacy regulation, similar to something like GDPR, the General Data Protection Regulation, I think that's what the R stands for, from the EU, which provides a lot of privacy rights to EU citizens, including in cases of law enforcement in the U.S., because of the current sort of hostility and conversations and the attempts or the desire to sort of be punitive and use some of the side data to identify potential health, conditions or health procedures or health actions.
Yeah, that makes a lot of sense. And there was something you said earlier about the multi-use of devices in hospital settings that are basically gateways for potential attack or entryway into a network, and that being tied to a lot of potential issues, but also the fact that hospitals have been targeted, healthcare organizations, not just hospitals, have been targeted. But a lot of data breaches have come in the last few years, and I think that has added on to another layer of just general mistrust too with the general population around how safe is my data, who's getting access to it, why is there interest in my data, and how is it being used. I think there's also a separate conversation about how is it being used and if it's being monetized. Where's my piece of the pie? But should the healthcare sector be concerned because of the higher interest or the recent interest in patient data, the spike in data breaches that are happening, the fogginess of the regulations, what's needed, what's required, what isn't, those who are skirting around it? Is that something that we need to be highly concerned about? Is that something that you think will, with time, adopt some of the practices that have already been currently used?
I mean, I think healthcare needs to be thinking about this, but we're really talking about an issue related to capacity, and I say this because folks who work in IT at hospitals are typically paid way below what would be considered the market rate within sort of the tech industry, and so hospitals are not always able to hire people who have let's say like sort of security knowledge or awareness, and so they might be, and organizations as well. I don't mean to sort of only point out hospitals, but organizations like Planned Parenthood, for example, might not have capacity also to hire folks to work on security, or security and privacy, I should say, and so there's a very difficult balancing act that. I think hospitals in particular have to play around like what needs to get done, how they need to communicate with some of the risks and the risks that they may or may not even realize or know about. If I remember correctly, Open Privacy, an organization based in Canada, did some research a couple years ago related to the healthcare industry and linked to sort of, I think, walkie-talkies and sort of the information that was being, sent over walkie-talkies. And that's something that's like completely invisible and, hospitals might not be aware of or thinking about. But those communication streams that are also like essential for being able, again, within a large space to communicate can be unsecured. And it can take a lot of effort to work through all of this. And so while on the one hand we'll say like I think healthcare organizations, whether hospitals, whether organizations like Planned Parenthood that are not that are providing healthcare, maybe not in a hospital setting, but directly linked to maybe helping people get to clinics or get access to healthcare, need to be thinking about this more, but they might not be due to capacity. This is slightly different, I think, from the IoT or wearables space where they might be paid market rate. But oftentimes, I think the conversation becomes less about we'll say like maybe less about like the health information and what is not considered health information and how that can be used. And, and that gets into, I know there are sort of the FTC and others become the enforcement mechanism, but it doesn't necessarily mean that the incentives are aligned as it might be with, let's say, a hospital. Yeah, so I think in general there's a large question like how do we incentivize people who are good at these things to go into, let's say, hospitals or other places as well?
Yeah, the incentive structure is something that I've been thinking about a lot recently too. There's a lot of incentives that don't match up for people that have to get the job done together. So that's really hard. I see that if there isn't capacity for these hospitals or for these healthcare organizations, how much of it do you think is just a matter of education and content, right? So if the knowledge is known about how to keep certain systems safe, how do we then disseminate that to those who may not have that capacity to hire that market rate person who can actually help them with their security? That's where my mind goes next.
There's probably an element. We'll say, like, when we think about the broad spectrum of breaches, whether like sort of data breaches or or hacks as people might talk about them, I think largely there's sort of two we'll say 2 or 3 types. One is what we might talk about as like the low-hanging fruit. It's not necessarily targeted, and I think of something like WannaCry was like this, where there's probably known things that can be done, and relatively known things that can be done and implemented. It still might take effort, and it might take customization within a hospital environment or for an organization, but you can do a lot to help mitigate a lot of those. There are, we'll say, issues that come from error, whether like sort of human or technical error that happens. And I think the example that you gave previously is like people might be collecting data, analyzing data, and might not necessarily have the capacity to realize that they're accidentally sharing, publishing sensitive information. And, that's largely, let's say, an error that happens within, that's not intended to be a data breach, but again, can still have these negative impacts. There's probably some that can be done around informing folks or helping incorporate, known methods or tools. Most people will probably talk about things like differential privacy, but differential privacy doesn't fit all of the use cases. And in particular, it doesn't always work within the medical field, where you might be interested in nuances that can exist. And part of what differential privacy does is it aggregates information, but it also adds a little bit of noise, and it might decrease sort of accuracy, or it might change up the results a little bit. And that might not work within the context of a medical study. I believe NVIDIA has been working with hospitals around what we talk about, sort of like federated technologies, and like how we
federated learning.
Yeah, exactly. So there are emerging tools that can be used to help better protect some of this data. And so I think there within that sort of like mistakes or that analytic space, there are things. But the one that becomes, I think, the most concerning, that it really comes down, I think, to a capacity issue, is going to be, we'll say, targeted attacks. And that, I think, is becoming more common within the healthcare space. It's certainly something that's seen with organizations like Planned Parenthood that maybe aren't necessarily a hospital. But I believe there's been instances where that's actually, like, hospitals themselves have also been targeted, or health information systems have been targeted. And it becomes an interesting thing about, like, how do you manage this, especially as I think sort of during COVID-19, when everyone was working remotely and people weren't going necessarily to the doctor, telemedicine had improved and has become a much more commonplace thing. And I think of this in particular with mental health and therapists. And you're then relying on another platform potentially to manage that security. You might not have access to knowing even what information they have access to, or what they share, or how they sort of protect against things. And so there is like maybe an element of like understanding and learning for those third parties. But if you're really under a targeted attack and you're maintaining these systems, you're going to need capacity to do constant like monitoring to ensure that you can detect something that starts to look odd and help prevent something from happening, or when you notice things, to make changes very quickly to defend sort of your network and sort of the data that's in your systems against someone who is dedicated and maybe has a lot of time on their hands, or they've been watching sort of information flows, or looking at your network, or looking at your applications for months or years even.
Yeah. I think that sounds like there's some low-hanging fruit, and there's a roadmap that we could at least start with for things that we already know, right? And there's proven strategies against it. Is there anything that you think we haven't discussed when it comes to privacy and security, and maybe something that the healthcare industry is missing?
I think the biggest thing within the healthcare industry and sort of like security, well, we'll say really privacy, is just knowing and thinking about sort of the data that's being collected and the implications. I know there is a lot of empathy within healthcare professionals, and I know that's also been strained recently with sort of like overworking. That and maybe it happens a little bit more with like medical researchers, where you can forget that you're talking about real people with this data, and it's so easy to do because when you look at numbers, you maybe forget that there are people behind it. And that's when, like, I don't know how to necessarily, solve or slow down, folks. But that's one of those, I think, human questions around, like, what should or how should healthcare organizations or like hospitals or like telemedicine folks view their role with like informing folks, like helping protect that data and like viewing, the people behind the data as well.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.